One of the main things that we see in medicine now that we never used to see before in prior decades is the loss of continuity. And part of the excellence of care is continuity. Somebody being responsible, somebody being the quarterback of care. And to be quite honest with you, there's no reason why a third-year student can't take it upon himself or herself to get that continuity and excellence of care. And what I mean by that is, if you've ever seen a note in the hospital for a discharge day, or if you've ever been to the ER yourself and seen ER sheets, it'll say, patient has such and such, so I did this test and that test, and I'm discharging the patient home on Cipro. And then the next 3 pages are these generic discharge instructions. This is what you should do if you hit your head. This is what you do if you have a urinary tract infection. It's generic. It takes away from the ability to really read the chart, and it really takes away from the continuity of care, because as you know from your first 2 years, you have lectures on health literacy, and not every patient is able to interpret these large amounts of paperwork that goes home with them. So you're going to start to learn that continuity of care is an issue. Care gets handed off in the hospital because your residents have hour restrictions. You have the hospitalists who've never seen the patient before. You have the internist or the primary care person who's taking care of the patient in the office, who will never see the patient in the hospital, and hopefully has provided all the information that is necessary for that continuity of care. The best thing you can do at this stage is start to evaluate that the continuity of care and the excellence of care is following through. This continuity of care, particularly for the discharge date, means that somebody has to look at what medications the patient goes home on. Are they correct? Have the dosages been verified? Have all the tests come back? I can't tell you how many times a patient is discharged in the hopes that the test result was negative, when in fact there's something crucial about a CT scan or an MRI or a particular lab test that was done on the morning of discharge. And this is the thing that I think could be most exciting for a third-year student, is keeping a patient diary for each patient. It's not just the history and the physical, but actually looking at how things are going and following this through all the way to discharge and verifying that these things are accurate.